The question, what do acne scars look like? In order to treat acne marks and scars, it's helpful to learn how to distinguish between the two. Patients often mistake dark spots for acne scars, but they are actually very different. Post-inflammatory hyperpigmentation is red or brown marks that usually go away when you gently stretch out the skin. These marks can take 3 to 6 months to go away on their own, and you can expedite the process with a diligent treatment of topical retinoid, vitamin C serums, sunscreen, and over-the-counter brighteners. True acne scars, however, are permanent indentations from collagen damage and can come in many shapes and forms, and laser treatments and temporary dermal fillers are the only ways to treat the issue. Some scars are thick, raised, hypertrophic scars that stick out above the skin. Others are keloid, which are scars with overproduced skin tissue. Then, there are atrophic scars that appear as depressions in the skin, and they're the most challenging to treat. The three main categories of atrophic scars are ice pick scars, deeper than they are wide, with jagged edges. Sometimes they resemble a large, scooped-out pore. Boxcar scars, broad, rectangular depressions with steep, defined edges. Rolling scars, broad depressions that have rounded, sloping edges, hence the name. The dark spots that remain on skin called post-inflammatory pigmentary alteration are caused by inflammation during the skin's healing process. When your skin is opened up, like when you pop a pimple, and then closes back together, you can get abnormal pigmentation, texture, and tone that look different from the rest of your skin. Sometimes broken blood vessels that remain after an acne lesion fades can result in a mark that appears more red or purple than brown. These are commonly seen in people who are more fair/light-skinned. Since it's so difficult to know what causes one person to scar more than another, the best way to avoid it is to treat acne with a great skincare routine, and that means you need to resist picking, poking, or touching a pimple. But sometimes a particularly aggressive blemish is truly on a mission to leave its permanent mark. Acne scars occur when normal tissue in the skin is destroyed and replaced with fibrous tissue. You can think of an acne lesion as a wound. When the damage caused by acne is severe, the body can respond by creating too much tissue or too little tissue. The production of too much tissue forms a keloid or a hypertrophic scar, and too little tissue leads to that depression in the skin, or atrophic scar. The deeper and more inflamed the acne lesion, or the more that it is picked or squeezed, the more likely it is to scar. Some acne marks and scars are completely within your control, while others are predetermined. People with deeper skin tones may develop darker marks or hyperpigmentation, while people with lighter skin tones may notice redness. Aside from genetics, there are several lifestyle habits that can make dark marks and scars worse. Sun exposure can supercharge melanocytes, or pigment-producing cells, causing marks and scars to darken. And, of course, picking or squeezing pimples creates further inflammation and can ultimately lead to more damage.